Let's shine by seeing the best in all of us and by treating you here, right in your hometown. Let's look out for each other. Let's stay healthy. Let's shine together.
Hi, I'm Sharrie Harlin, program host for Let's Talk Together. And today we are going to discuss International Overdose Awareness Day. And we have our two guests today, our Sayward Salazar.
Hi.
And Dianna Naylor.
Hi.
And they are with volunteers of America, Indiana, and Ohio.
Ohio and Indiana.
Ohio and Indiana. Okay, a long title there. But before we get into our discussion, tell us a little bit about how you've been in the mental health and addictions, behavioral health arena.
Sure. My name is Sayward Salazar. I am the Vice President of Behavioral Health for Volunteers of America, Ohio and Indiana. And I got my bachelor's degree here in Richmond from Earlham College in psychology. And then I went on to IUPUI and received my master's in social work. From there, I became a licensed clinical social worker. So that's 2 years postgraduate under clinical supervision and then passing a licensure exam. So I've been a case manager for children. I've worked for Department of Child Services as a family case manager. I've been a clinical supervisor. I've been a regional manager, program director, site director, all sorts of things. And then I sort of ended up at VOA about 4 years ago and wanted to pursue a little bit different kind of career in a different type of organization and have been there ever since.
Great. And you, Dianna?
I got my bachelor's degree at Manchester College in social work, and then I got my counseling degree at Franciscan University of Steubenville. And so since that time, I've done mostly drug and alcohol counseling and mental health counseling. I was in Ohio for many years, so they call that SAMI, so substance abuse and mental illness. Came here to Indiana and continued that arena. Became a clinical supervisor about 5 years ago and was with Meridian Services, and now I'm with the Volunteers of America.
Okay, well, great. So we're delighted to have you both on today's episode. And August 31st is International Overdose Awareness Day. And have you always celebrated this or within your organization? How do you recognize International Overdose Awareness Day?
Unfortunately, in the field that we're in, we experience a lot of loss due to overdose. And so for our staff, it's often a day to remember clients that we've lost throughout the year. And a lot of clients use that day as a way to remember friends and family that they've lost also. So it's more of a day of memorial for a lot of our clients and staff at VOA.
And this is celebrated all over the world. The biggest thing is also to remember those people without stigma.
Yes.
And and we'll get to stigma in a minute, but first, so what's an overdose? What is an overdose?
I can go. Do you want to go? So an overdose is when there is a substance in your system that is more than your body can handle, essentially. And so your body will shut down as a reaction to having too much of a substance in your system. And that substance can be alcohol. That substance can be over-the-counter medications. That substance can be really anything that your body just can't handle the amount that's in it.
And so some of the signs and symptoms, what are some of those?
Some of the signs and symptoms are non-responsiveness, the lips turning blue. You can't rouse the person. They're not responding to their name. They may not be breathing. A lot of different things you might find paraphernalia around them.
And I think one of the misconceptions is, as you said prior, any drug can actually lead to an overdose.
Yeah.
And so another thing is, how do we identify an overdose? And I know we'll have some slides here
Yeah.
shortly.
So, like Dianna said, making sure that if somebody is not responsive, you see the blue of their lips, they're not breathing well or at all, those can all be signs of an overdose. And it's really important that as a community, if we see that we are calling 911. If you do happen to carry Narcan, which is a drug that can reverse an opioid overdose, that you go ahead and administer that, even if you're not sure if it's an overdose, because it doesn't harm anybody. It's completely benign. So you can give this drug to somebody who's having maybe a diabetic episode and it's not going to harm them. But if they did happen to be having an overdose, it could rouse them
So
and
back
save their
on
life.
when it says, evidently, best, it's a key word. So you identify breathing, and are their eyes dilated, or little pinpoints? And is their skin?
Pale, clammy, and then again, not talking, unconscious would be a sign that they're not okay.
And when we're looking into the best process, what can we do if you see someone that is experiencing an overdose?
The first thing would be to call 911. The second thing would be if you do have Narcan, which would reverse an opioid overdose, would be to go ahead and administer that right away. Don't leave the person. Don't put them in a shower. Don't do any of those, kind of old school kind of techniques that people thought would rive people in the past, because that can be really dangerous for them. And so it's just important to call 911, Narcan them if you have it, and stay with the person until help arrives. Yeah.
And when you've talked about the Narcan, and where are they available? Is Narcan widely available? How would a person know?
Yes, it is widely
Yes.
available.
Okay.
In fact, you can get it at the neighborhood health clinic. There is a Narcan box in the parking lot there that anyone can go get doses, either for themselves or to have for family members. I personally carry some in my purse at all times, and I receive that free through Overdose Lifeline. So that's another organization that hands it out for free. I know that there is a vending machine also in the jail, in the waiting room there. So if you need it, you can go in and get it for free. So really trying to flood the community with this life-saving drug so that we don't lose anyone to an opioid overdose.
I was recently at a community event, and there was a table just to educate people, and they handed people the Narcan box and were given examples on how people could utilize the Narcan.
Yeah.
So I thought that was very educational for the community. Another big thing has been the maternal mortality rates, along with overdose. Can you share on that?
Do you want to go or you want me to go?
Well, I know when I was working at the Nest, we did not see any mothers pass away, and only 2 babies had to be put on a drip to keep them from going on, through withdrawals. But I did not see any infant mortality during that time, and that was 2 years. So I think the Nest is doing a great job in helping women prevent that.
So the state of Indiana did a maternal mortality review, and during that review, they did find that 80%, I think someone hopefully can double check me, but 80% of maternal mortality deaths within that first year postpartum were related to substance use in some way, which is a really high number. And so what we're seeing is that as women are in treatment during pregnancy, that treatment is not always lasting during that year postpartum for them. And that's an extremely dangerous time. If you've been in treatment and you're on Suboxone or methadone and you stop those drugs and you go back to using an opiate from the street, your chance of overdose is extremely high because your body is not used to having that substance in your system. And so you may go back to using the same amount that you used previously and your body can't handle it anymore and you will overdose. Postpartum is also a really dangerous time for women in general. We have postpartum depression, there's a lot of isolation, there's postpartum anxiety. And so you have all of these things going on. And then, oh, by the way, you also have a substance use disorder and you feel isolated, and if you don't have family support and enough help, it's a really difficult time to navigate for those of us that are high functioning individuals. If we're struggling with mental health and addiction, it becomes an even more dangerous time for us. So that, we call it like the fourth trimester, is really important for women, that we are wrapping around them and ensuring that they are able to get services. One thing the state of Indiana has done that's really great is that they have expanded the pregnancy Medicaid to 1 year postpartum. Yeah. So that allows women who may not have necessarily qualified for regular Medicaid to stay on that for a year postpartum. So it gives them the opportunity that if they do need case management services, therapy services, and substance use treatment, that they're able to receive those services.
And that's huge, because we've seen just, you might not have seen it directly here in Wayne County, but as a state, for the state of Indiana, we've had a very high maternal and dealing with mortality rates. So that the extension for that postpartum year is huge.
Yeah.
The also, let's talk about accidental overdoses. Are in 36.5% of all pregnancy associated deaths. So, any comments on that?
It's an unfortunate statistic, and it's important that it's pregnancy associated. So this doesn't mean that the women are pregnant at the time. It means that they are in either they are pregnant or postpartum, and that pregnancy is associated with that overdose. And it's really sad that people aren't able to get the help that they need and able to stay in treatment as long as
hopefully
they need to stay.
that number can go down. And that also follows back on at the beginning when you were saying that they made it through the pregnancy and then I'm going to go get high.
Yes.
And using the old amount that they thought they needed before they became pregnant, and then they OD. So.
Yeah. And Indiana's done some other really great things with grant funding opportunities for women to be able to stay in treatment with their children. So Volunteers of America is really unique in that our residential treatment centers for substance use disorder allow moms and babies and toddlers to stay in treatment with their parent. And so that gives them the opportunity to stay a little bit longer. So our program is 84 days, but the state has given us some grant funding to allow some people to stay even longer if they need to. One of the biggest barriers that we have right now is we'll get folks, we'll get them sober, we'll get them, in treatment, and they're doing really well, and then it's time for discharge and there's no housing available. There's no transportation available. And so sometimes we need people to stay in treatment longer, because if we discharge them to an unsafe or unstable housing, that's going to increase their stress and then put them back in a position where they feel like they have no other option. So we want to make sure that folks are really set up when they leave our facilities.
And can you explain the process, how people come to Volunteers of America?
Sure. So we take all kinds of referrals. They can be self-referred. They can be referred through Department of Child Services. We get some folks directly from jail. Jails don't generally like to keep pregnant women who are withdrawing in there. So they will call us. So we get folks from a wide range of referral sources, and they come into our treatment program. And the first 30 days is your basic, what people consider rehab. They're not calling out a lot. They don't have access to their cell phone. You know, they're doing, 4 or 5 hours of group per day, and they're really focused on their treatment. What's unique about our program is after that 30 days and they've been successful, they're able to go into phase 2. And what phase 2 allows for mom to work part-time and to leave the building on their own, so that they're able to kind of test the waters and see, how do I feel about going and hanging out with my family for a few hours? Does that feel okay? Do I feel safe going there? And sometimes people literally come running back to the building because they're like, I'm not ready to be out there yet. I need some more time. I need to work through some of my stuff, or I thought I was going to be okay seeing this person and I'm not okay seeing with them. I still need to work through some of the trauma that I've experienced.
So you do allow them to come back?
Absolutely.
That's great.
We have people come in and out 4, 5 times. However many times you need to come to treatment, we are going to welcome you back into treatment, because everybody is different. And 30 days is an arbitrary number that insurance companies came up with. 30 days is not often enough time for somebody to really get into full sustained recovery. And so we do allow people to come back into the program.
Great. On another thing, so interventions. What are some of the interventions that you've seen that are successful?
Well, of course, outpatient treatment can work. Residential treatment, intensive outpatient, but really getting behind the problem is what's really needed for people. Developing a different network of friends and associates is really key. Getting into the 12-step programs or Brianna's Hope or even church, whatever it is, but changing those people, places, and things is going to be a key piece of the change that needs to happen.
And how do people learn about those particular, like a Brianna's Hope? How do you guys do referrals, or how would a person learn about other places that they could go to?
A lot of times we have lists,
Okay.
and we would take them to meetings and introduce them to people. There is here in Wayne County, there is Recovery Rocks, which is really focused on women, which is very important at that point for women to just build a different network. Mm-hmm. You can find them in the newspapers. You can find them online. You can go to meetings through Tele. So there's a lot of different ways. But yeah, just sharing that information with people
That people can learn about.
Yeah.
And I'm seeing that women at risk for substance use disorder are they being provided naloxone upon discharge from locations? I'm not just sharing your location, but if they went anywhere.
I don't know. I can't speak to anywhere. Mm-hmm. I do know that we do provide it for folks who are discharging. Mm-hmm. It's free. We get it free through Overdose Lifeline, and so it's something that we want to make sure they have access to when they're leaving. As far as other facilities, I can't speak to them. I'm not sure if they are doing the same thing.
Yeah, and according to the Indiana State Police, meth is almost outstripping fentanyl and heroin, so naloxone isn't going to be able to stop that. And because meth is, just going to astronomically, shoot your dopamine up, and the effect that it has on the brain, people go back time and time again for that. So it's really scary with overdose when it comes to methamphetamine. Everybody's going to be chasing that high, because after that initial high, you can't ever go back to that. But that's what everybody wants, and so that's why it's so powerful. And it's really scary that the meth is being, pressed into pills. It's being, put into, joints and different things like that to keep people coming back, because it's like, oh, that joint was really good. I'd like some more of that. And they don't really know that things are being laced, And one of the scary things that is happening right now is that we have seen some people take the xylazine or the trank, okay? And that trank is basically that horse tranquilizer, and it does not work.
Wow.
The Narcan doesn't work on that, and so they're cutting the trank into fentanyl. They're cutting it into a lot of different things, and it's very scary because people aren't coming back from that.
And in addition, do we have a different awareness because we're more in a rural area? Do you see, because it's more access to like the horse tranquilizers or different farming tools, that you see more of a mix?
That I don't know about.
Okay.
I don't know. I just do know that that what the state police is really concerned about is, people that ODs have increased since the pandemic. Okay, that's gone up astronomically since then, and it's already here in Wayne County. So I'm glad we're doing this and talking about it.
Then what are some of the other things that you've seen? I've been out in the community in general. I've seen where on Overdose Awareness Day, people will put like memorials around, especially I know with Drug-Free Wayne County usually has a big event. So in different counties, are you seeing people celebrate Overdose Awareness Days just in their own way?
I think every county has some sort of drug coalition or group that's pretty active, that is able to, do some events and do some outreach and awareness on that day, yes.
Yeah. And I've just moved back to Randolph County, so I'm not sure what all they do right now. So that'll be interesting to talk about and have that conversation in that area.
And what's some other things you'd like people to know about what Volunteers of America offers?
So Volunteers of America is a national nonprofit organization. We are one of the oldest nonprofit organizations in the country. We're over 125 years old. We are a Christian-based organization. We are faith-based, and that really drives a lot of what we do and what our mission is. In Ohio, our Ohio branch does a lot more reentry programming, so that's for helping folks who are coming out of jail and prison to ensure that they're set up to be successful. They also have a lot of thrift stores, so much like some other nonprofit organizations, a lot of our programming is funded through our thrift store operations. And then in Indiana, we do some senior services and veteran services in Fort Wayne and Gary. In Indianapolis, we have a Fresh Start program. We also have a prison reentry program, and we have a Turning Point program, which is substance use treatment for men. And then in Winchester, we have Fresh Start, which is our substance use residential treatment for women and children. We also have that in Columbus, Indiana. We have a recovery house for women and children in Columbus, Indiana. And then we also have another Fresh Start program in Evansville. And Evansville also has veteran services and reentry services. So VOA does actually quite a lot
Yes.
in social service in both Ohio and Indiana. We're trying to get our name out there a little bit more so people recognize, what we are doing and the good we are providing to the community. And although our Winchester facility is in Randolph County, we serve a lot of Wayne, Fayette, Union County folks, also Delaware County within that Randolph County location. So we see a lot of local folks.
Yeah.
I see a lot of people I've worked with over the years too coming through. So we have a lot of connection.
And
to
I
Wayne
know
County.
it's especially having the services for women and children is a differentiator.
Yes. Yeah, we're very different in that we do that. And I think that, there's a lot of fear of treating pregnant women with addiction because, you're not just dealing with the health of the mother, but also the health of the baby. And so we have close relationships with other organizations. The Choice Program from Community Hospital is a program that is focused only on pregnant women and substance use. And so they work very closely with us that if they have folks that need a higher level of care, if we have someone that needs detox and they're pregnant, we contact them and they can do their hospital detox with them. So we've really worked to be able to provide, more wraparound type of services for the pregnant women and moms that we're serving.
That's great. And you mentioned your location, but I'm sure we will have information for the Winchester location as well. Is there anything else we might have missed that you would like the people to know about what you're doing, as well as International Awareness Day?
I think the only thing that we didn't maybe touch on was stigma and how important it is for the community to recognize that people with substance use disorder are people and that they deserve to live and that we should do everything we possibly can to keep people alive until they're ready for recovery. And that can be very frustrating for family and friends as they watch folks continue to overdose and continue to go down a path that is very scary and harmful for the whole family. But at the same time, when we do see people come out of that, when we do see people come into recovery and embrace recovery, it is just amazing to watch how they can blossom and how many of them give back to the community after that by becoming peer recovery coaches and doing that outreach with other people who are suffering with addiction.
Well, with that, we want to thank both of you for joining us today on Let's Talk Together.
Let's shine by seeing the best in all of us and by looking out for each other. Let's stay healthy. Let's shine together.